Good afternoon, good morning, good evening. This is the usual Unicom Committee of Expertise after some break. We are going to start in a couple of minutes to let the participants time to join us. So good afternoon, good evening, good morning for us. Welcome to this November Unicom Committee of Expertise. We have quite a large number of registration for this afternoon. Not everybody is on board yet, but we will let people time to join us. To start with, I have some introduction slides, so it's not lost really. Today we are talking about access to European substance data, and we are providing a deep dive in it. We have a very nice set of speakers who are going to be presented on a later slide, but you have the name already here. We have rules. And the rules are mostly the same for a long time already. The rules start with this. All the participants are on mute, except the speaker. Everybody is on mute. We have a question and answer facility on this Zoom webinar. I will show you how to activate this. And we encourage you to ask your questions with this tool, which allows us to answer questions in a written way during the presentations, if that's appropriate, or to collect them for after when we have the time for debate. If somebody is invited to speak, and that can be one of the speakers in the Q&A, of course, one of the panelists in the Q&A, but also it happens that sometimes we give the microphone to an attendant, and we just ask to be concise so that everybody has time to participate in the debate. There is a system solution to show your approval when we have a question or an answer, and I will show you as well how that works. So to activate the Q&A facility, you move the mouse on your screen, and you will see here on the bottom of the screen Q&A, which you can also then activate by clicking on it. And you see something like this, and you have the space to type your question on the lower level. Then we, from the speaker and the panelist and the moderator, we can answer the questions or comments. Sometimes we will forward the question to one specific speaker, you may also write directly, Mr. Jones, this is my question for you, but otherwise we will do that. And you see on the left of the smaller screen, you have this thumb up, and that's the way you can say, yes, I think this is an interesting question. And when we have many questions in a row, so having more thumb up moves the ranking of the question. This is a secured session. Zoom has regularly improved the solution to have safe access to the webinars. So everybody has received a personal link to join. And in that sense, this session is password protected. It is recorded and will be posted on the Unicom YouTube channel. You see that here, but you can find this also from the Unicom website, of course. At the end of the session, you will see a slide where you have a link to a short questionnaire. That link also will be posted in the chat box for everybody towards the end of the webinar. And tomorrow, the participant will receive also a thank you email where they will find again the link to this questionnaire. We attach a lot of importance to this questionnaire to understand if you were happy, if you have comments, positive or negative, which allow us to improve our processes. So now our panelists and speaker to start with, of course. We have Annet Rozema. She is working with CBG, but she is particularly one of the lead for the Unicom Work Package 2, the one working on substances. We have Mirjam Keulen. She's a substance expert at CBG as well. She is for 2 years now involved in the EU-SRS project, and she currently focuses on protein. We have Edita Burda-Dagish. She's substance expert at BFarm. And we have Marcel Hoefnagel, who is senior assessor for biopharmaceuticals at CBG. These are the speakers. We have Pedro Batista from European Medicine Agency, who will be a panelist. We know that he has difficulties to join us, so we don't know exactly how we will sort that out, but we will find a way, of course. And you have to support all that two moderators, my modesty, and Robert Stegway, who you don't see, but he is in the background and managing the Q&A and sorting out possible issues behind the scene. Here the link, first time, but nobody can copy that, we understand that, the link to this questionnaire I mentioned before. And now I'm going to give the floor to Annet Rozema for the introduction slides.
Yeah. Thank you, Christian, for the introduction. We're very happy to be here today and to present to you some actual data from EU-SRS. The team has worked hard over the past years to define how to build records, to work on cleansing together with email and SMS data. So yeah, again, we're very happy that we can share some of those results with you today. Next slide, please. So we have a busy agenda. First, I will spend some slides on the EU-SRS background and status, followed by Mirjam, who will guide you through the proteins. Edita will cover the chemicals and the polymers, and Marcel the human vaccines. And then hopefully we have some time left for questions and answers. Next slide. So first about the background and status. Next slide, please. So this is a busy slide. I will not read everything to you, but this was one of the slides that was used to explain EU-SRS to the Head of Medicines Agency meeting in 2020, when we received approval to go ahead and implement EU-SRS. And at the bottom you see what is EU-SRS. It's with EU-SRS we ensure an EU network-wide scientifically sound substance database governed by a group of NCA substance experts called the Substance Validation Group, who ensure that data quality is fit for SPOR use cases. So it's about a system, it's about governance of data, it's about data quality. So a wide scheme of topics that that the project is covering. Next slide, please. So this shows nicely that the Substance Validation Group, they work on setting standards and best practices. I have a separate slide on that. They act as a knowledge platform, and that is what we have seen over the past years. I think the team has grown their knowledge quite a bit, and that is also valued by the team members. We are involved in data cleansing of SMS data, so that means that the SVG, based on our standards, provide feedback to the SMS team on what needs to be changed, and then Pedro and his team pick it up and implement where they can. But of course also we define processes on how to characterize new substances. So we are in the rounding off phase of the project, I should say, and in the end, if we go live with EU-SRS, that also offers NCAs to link to EU-SRS or to import data from EU-SRS. And as you see also at the bottom, we work closely together with the FDA colleagues and NCATS colleagues on both on the software side, but also on the data side where we can. So we have frequent meetings to align on how to build, for example, polymers, how to build vaccines, and that is very fruitful also in the light of globalization. So next slide, please. And this is an interesting slide, I think, to share. It's not so much in scope of EU-SRS, but it shows the direction where we're going jointly. So the GSRS software that we are also using is open source software, free of charge, right? So we are using it in EU-SRS, but the colleagues in Germany have implemented already DE-SRS. Of course, FDA have their internal system, FDA-SRS, and there's also the public GSRS version from NCATS. Next to that, also industry is now looking into SRS, which is very good news. And also USP have now a system up and running for SRS, so the USP SRS. And also UMC, related to WHO, as you probably know, they also have UMC SRS. So this is a nice picture showing how open source software, where we work jointly on, is supporting the global direction. And on the right side of this slide, you see a possible model, thinking that industry may be able to build their own substance in their database and then share the same data with FDA, with EU, and also then maybe the public part of the data with UMC. So if that were to be possible, you would, it is a direction of global alignment, work sharing and standardization. And that is something we are now working on in sort of a pilot phase next to the activities towards go live. We work together with industry, with FDA and UMC to see how to exchange substance records, in particular vaccine records in this case. Next slide, please. And this is a nice picture of the overview of EU members taking part in the SVG. So you see quite a number of green members, green countries who are taking part in the SVG. Of course, Norway has a different color because they're not an EU member, but very active in the SVG. And France is orange because they have a member from a veterinary side, but not yet from human side. Most recently, Italy has added 2 members to the SVG, which we're very happy with. So I think we have a nice team, a quite stable team working together on substances on behalf of Europe, which is good. If you click one more, Christian. Yeah. So we work closely together, of course, with EMA, with FDA. with UMC. There are 2 members of UMC joining the SVG. They do not have access to EU-SRS because that's behind the EMA firewall, but they are working very closely together with us in how to build substances, and also from the point of view of growing global. That is very helpful. And industry is also working with us together. Next slide, please. So this is the structure of the substance validation group. Maybe you have seen this picture before. We have the SVG oversight. Marcel, who is on the call today, is the SVG chair. We have a key user secretariat from EMA. And then we have 3 validation groups, 1, 2, and 3, with all different areas of substance classes. And so we have experts in each of these groups with the right expertise, which is helpful. And today, if you click one more time. So Edita is part of substance validation group 1 and 3 actually, but today she covers chemicals and polymers on behalf of group 1. If you click one more, yeah, so Mirjam is covering proteins, and if you click one more, yeah, and Marcel is covering vaccines. So the expertise that is built within each of those groups is nice to see. We are documenting now all the sort of the best practices in the guides. And the expertise is of good standard, so that's good. Next slide, please. So preparing for go live, November is a crucial month for us. On one hand, EMA will install the new version of the software that we expect to receive soon from FDA, from NCATS. So we will have software validation at EMA. The data load still at BfArM, who is currently hosting EU-SRS, and then we transfer the data loaded at BfArM to EMA, followed by penetration testing, let's say a security test by EMA. And if that all paperwork, etc., is all done, that should conclude the official handover of the hosting of EU-SRS to EMA, and that is expected to be completed early December. So basically, the activities are in November. But of course, we need to have all the paperwork in place as well. And that means that from that time onwards, the SVG members will no longer work in the BfArM SRS, but they will use EMA SRS. So that is good. And then on the data side, after the initial data loads, we will proceed, the SVG will proceed building records directly in EU-SRS. We have earlier also used Sporify, but that whole chapter is closed. So after the data load, all the activities will be done directly in EU-SRS. And to keep in mind is it will not be the most efficient process yet, because there is no interface yet between SMS, the EMA substance management system, where you have names and codes basically. There's no alignment yet between SMS and EU-SRS because there's no interface. So we need to find a manual way to make sure that the data are staying in sync. Next slide, please. So, and this is an overview of some screenshots of the front pages of the guides. So we have end of next week. Please watch your LinkedIn or any other source. Next week, Friday, we expect to release the chemicals user guide, veterinary vaccines, polymers, homeopathics, human vaccines and proteins guides. We are very eager to put them in the public domain. And then you have a chance, if you wish, to provide feedback by December 8th. And then after that, we process the comments and then we finalize the version 1 early January. And that is a deliverable of Unicom, so quite a crucial step. I'm confident that we will deliver that. And what we cannot finalize yet is the processes. So we also need to have processes in place to describe how we manage the substances in EU-SRS, but that obviously also has a link to SMS. And the EMA colleagues expect to be available for those discussions early next year. So we said, let's finalize what we can in the draft mode and then pick it up next year with EMA to streamline, especially also with the focus on how to make sure we align between EU-SRS and SMS. So I think that's it. There is a question in the chat. What substances are validated in homeopathy? That's a joke, I guess. Believe me, we are making good progress also in homeopathics. So next slide, please, I think. Yeah, so with this, I hand over to Mirjam, who will guide you through what we have done with the proteins.
Hi, I'm going to show you a protein record in EU-SRS. Next slide, please. Okay. There are many different types of proteins. Our main focus at the moment are the monoclonal antibodies. So today I want to show you a monoclonal antibody. Monoclonal antibodies represent all defining elements of proteins. They have multiple subunits consisting of amino acids connected through peptide bonds. The subunits are linked together by disulfide bonds. They are usually glycosylated and have other post-translational modifications. The information in the protein records in EU-SRS is based on public information, but also on confidential information. I'm not allowed to show you confidential information, and I don't want to show you an empty record with only public information. For that reason, I am going to show you a record of a fantasy protein. I have given this fantasy protein the name examplisumab. So now I will share my screen and go to EU-SRS. Okay. Well, here you see EU-SRS. You see the protein record of examplisumab. At the left, you see the names of all the sections, and I will walk you through the records. We will start with the basic information. What you see now on the screen is the overview section. There you see already some important information. You can see that it is a protein. You can see the protein type and subtype. In this case, it is a monoclonal antibody of the IgG1 subtype. The sequence type is complete. That means that the full amino acid sequence is known. And you see the sequence origin, human in this case. Then we go to the names section. Here you see the preferred name, that is also the display name, examplisumab in this case. And you see some synonyms. You see the product name. And you see two systematic names that describe the structure of the protein. All the names have at least one reference. A related section is the identifier section. There you see a list of identifiers of the protein. You see well-known substance identifiers like the Cas number and the Unicode, and identifiers from other databases like the INN and NCI Thesaurus. You see the SMS ID, that is the identifier of SMS, the EMA database. And you see the SVG ID, that is the identifier of EU-SRS. You see references here. And when you click on the blue code, then you are directed to the website of the public source. The last section is the references section. There you find an overview of all the public sources and the European procedure number of the confidential dossier, all the information that is used to build the record. Now I will show you the defining elements of the protein. We start with the protein sequence. Here you see the protein sequence of all subunits. In this case, it is a monoclonal antibody, so there are 4 subunits. 2 for the heavy chains and 2 for the light chains. The subunits are linked together by disulfide bonds. You see them here. There are 16 disulfide bonds in this case, very typical for a monoclonal antibody. And on the first line, you see 1_22 and 1_96. And that means that there is a disulfide bond between amino acid 22 of subunit 1 and amino acid 96 of subunit 1. So this describes one of the intra-chain disulfide bonds of the heavy chain. Next to the amino acid sequence and the disulfide bonds, the site and type of glycosylation is an essential defining part of a glycosylated protein. In this example, the glycosylation type is mammalian. And there are 2 N-glycosylation sites on amino acid 301 of subunit 1 and 2, so on the 2 heavy chains. More specific glycosylation details are not covered in the protein records, but in the related specified substance group 1 records. I will show you that later. Besides glycosylation, there are often also other post-translational modifications. You see them in this section, substance modification. Exemplizumab has modifications that are typical for monoclonal antibodies. You see glycation, methionine oxidation, asparagine deamidation, N-terminal pyroglutamate formation, and C-terminal lysine cleavage. You see the site of the modifications, you see the amounts, and you can see the related fragments. In this section, all kinds of modifications can be described. For example, also coupling of chemicals or polymers to the amino acid side chain. The next section I want to show you is the section with the characteristic attributes. There you can find information about the molecular formula and a molecular weight of the protein. Then we have the section relationships. This shows the target of the monoclonal antibody. You see a description of the relationship with the target. In this example, exemplizumab is an inhibitor. And you can click on the target and go to the EU-SRS record of the target. Detailed information about the glycosylation is not covered in the protein record, but in the specified substance group 1 record. So every glycosylated protein gets a specified substance group 1 record with the glycosylation details. And when there are biosimilars, a protein gets 1 protein record and multiple specified substance group 1 records. Because biosimilars have the same defining elements as the originator, they have the same sequence, the same disulfide bonds, the same type and sites of glycosylation. So they can be described with the same protein records, but they differ in the exact amounts of the glycans. So they get their own specified substance group 1 records. In this example, you see that there are 2 specified substance group 1 records linked to this protein record. And I will show you one of them. You can click on the link and then you go to the specified substance group 1 record. You can see that it has the same look as the protein record. At the left, you see the names of the sections, and so you can go through the records. We will start with the basic information. In the overview screen, you can see that it is a specified substance group 1 record. In the substance hierarchy, you can see the relationship with other records in EU-SRS. And then in the next section, you can see the related substance records. So a specified substance group 1 record is always related to a substance record. And here you can see that it is, in this example, linked to the protein record exemplizumab. In the name section, you see the name of the record. It is the name of the protein, followed by a short code. We use the 4-letter suffix assigned to biologicals by the FDA. And if that is not available, we use our own code system, EU and a number. So the name of this example is exemplizumab EU-001. Here we have also an identifier section, the same as in the protein records. And we have a reference section with a list of all the sources that were used to build the records. Now I want to show you the glycosylation information. In the section substance modifications, you see an overview of all the specific glycans and their amounts and the percentage of glycan occupation. For glycans, for the name of the glycans, we use the Oxford notation system. We use glycan in the name and the code from the Gly2Can database. So for example, the most abundant glycan in this protein is A2F. 56.8% of the glycans are A to F. You can click on the link and then you go to the record of the glycan. There you can see the structure and other information about the glycan. Now I go back to the specified substance group 1 records. Another section with information about the glycosylation are the characteristic attributes. There you find a summary of glycosylation properties. You see the total fucosylation, total galactosylation, hymanose, and sialylation. So all the glycosylation information is captured in this record. So now I have shown you a protein record and a specified substance group 1 record. And that's what I wanted to show you today. Thank you.
Thank you, Mirjam. It's certainly enlightening. We have noted there were several questions in the Q&A, and we will see how many of these questions can be answered in a written way. With this, I move to Edita and give you the floor. Thank you.
Thank you. So I share my screen. So we'll see if it's possible.
Yes.
Now you should see EU-SRS. I'm going to show you one chemical, one polymer record, less difficult than protein what we saw before. I choose one without any confidential information, so we can go into a real record. I search for that one, and you can see the search result here. It is the folinic acid. You see the short overview of most important information. If you would like to see for more data, you just select the name and you go into deep view of the record. As Mirjam explained before, we have on the left side different tabs, so you can change from tab to tab what you like to do, or just scroll down what I'm going to do and show you. On the top, you can see the record name is folinic acid, and the overview include the substance class information, which is the chemical. The below, we see the substance hierarchy, but I'm going to speak about this one a bit later. Then the next one is chemical structure. This tab was not included in the protein record. It's just specified for chemical record. So you can see the structure here. The molecular formula and molecular weight are generated from the structure. You can also press the bottom show stereo, and the descriptor will be shown on displayed of the on the stereo center. The other possibilities also show systematic names that way, and you can see the systematic name of this substance. The next section is chemical moieties. This is generated by the system, so it's just the overview of most important information like the structure. So again, the molecular formula and molecular weight. And then we have the name section below. We see again folinic acid, which is the preferred term. And you can see the blue one check mark behind. This market indicates the preferred term in EU-SRS, and the gray one indicates the preferred term in SMS. And in this way, you can see both check marks are set for the same name, so the preferred term in both systems is the same. Folinic acid is the official name, so you can see the name type official name. And with data, you in this pop-up window, you see the naming organization, British approved name, which is responsible for this official name, and we accept the name, his name in European jurisdiction. With references, view reference, you will see other reference to another scientific databases. Below, displayed another names, and the systematic name is exactly the same what we saw here above. So every name with name type systematic name will be also displayed below the structure. Next section is the classification, and this domain and category comes from SMS, and the based on entry in RMS catalog. So what we see that the record is the chemical, what is the same substance class what we have for this record, and domain is human use of the substance. The identifiers, the next code section include here a lot of IDs from different databases like CAS from SciFunder or the FDA, UNI from FDA. Mirjam explained already before that if you select one of these IDs, you will be redirected to the another database. The lack one at the moment are not connected to SMS. And the next section are relationship. So you can see in this section all related compounds to this one, like salt of our folinic acid if you select calcium folinate. The next window open and you can see all detailed information from this record. And relationship is that what I would like to show you for this one. So you can see active moiety of calcium folinate is folinic acid. And from that position or from the relation below, you can go back to the parent record, which is folinic acid. I'm sorry, 1 second. Then I have references, which include the information of every referential database. And on the top, something what I would like to show you. We select also most important references for every substance. In the case is a British approved name, because there's also the naming organization for the preferred stem. In this section could be also ENN, communal proposed list based or PHM monograph reference. And we have substance hierarchy. I didn't explain it before. So this hierarchy includes the same information what we saw in a relationship. So you can see our parent record and also all related record. And once again, I would like to show you. Our ZEDGE result. Here you can also see the hierarchy. And from that one, you can change to every related record. It was not possible in the title list, but here you can do. So it was the chemical record that now I'm going to show you a polymer. I choose again general record without any confidential information. See a hierarchy below, and it's a bit different than for chemical. In this case, we see in hierarchy most specified record. So Macrogol is one general record, and the other one with a mole weight behind. I'm very sorry, I have to drink something. So I'm going. I'm going to show you Macrogol in details. So we, the left side, you can say all tabs and some specified tabs for polymers like structure or monomer section. But we go just section by section and I scroll down. So substance class is polymer. We see again the definitional references, and in this case, macrobol is its ENN name, so we can see recommended and proposed list as citation. We see a macrobol hierarchy with other macrogoals type at the moment just 2, but we will connect to all other relevant macrogoals in later stage. The polymer display structure, you can see here in this section the structure of the polymer, also the information about class, polymer class and type. And in monomer section, we see the monomer of the record. There are no information set for amount because it's general record. Then we have name section, and again the EU-SRS preferred term and SMS preferred term are the same. It is again official name, and we naming organization is ENN. We accept this name in European jurisdiction, and we can. I'm really sorry. See another. Another references below. Again, the classification, which are domain and category from SMS identifier, in this case, also include ENN number. And then we have a relation to specify the record with small weight behind. I select one of them. And I would like to show you two sections. It is macrogol 300, so the mole ratio of ethylene oxide is set to 6. And we also add the characteristic attributes, just properties of the record, which is molecular weight, this 300 Daltons. Depending on the polymers, we also add the viscosity for several records. I go back to macrogol, and I would like to show you reference on the end, and that's all I wanted to show you. Thank you. I stop sharing, and floor is yours, Marcel.
Thank you, Edita. And I'm very happy that you and Mirjam showed already a lot of details of the database, because I prepared my my presentations without the use of the database. But you've shown these good parts and like the, let's say, how the database works. If we go to the next slide, please. So I would just give some introduction about how we build and structure human vaccine records in EU-SRS. So it starts with the names we give to these records and the hierarchy. And you've already seen something of the hierarchy in what Edita was presenting. And I'll try to see if I can tell you something about what we consider defining elements for the vaccine antigen records. Things like amino acid sequences, as we've already seen from Mirjam. So if we go to the next slide, please. So if you look at vaccine substances, and I've taken a picture here from all the antigens that are used for vaccination against COVID, you can have different types of antigens. So this can be just an inactivated virus or a live attenuated virus. It can be a viral vector or virus-like particles or just a protein. But most of us have probably been vaccinated with the mRNA vaccines. So these records, these substances have all should all be built in the substance database, and we want to capture them with their defining elements. And for each of this type of antigen, we already got examples built, and currently we are in the process of building records, and I'll show you the progress at the end of this presentation. And what you also can see for this COVID is that for the same pathogen, that we can have different type of antigen types. But as I said, we normally start with the naming of the antigen. If you go to the next slide, please. So the example I'd like to start off with is the Neisseria polysaccharide. So if we got Neisseria meningitis, so to vaccinate against that, the polysaccharides in themselves are generally not immunogenic enough. So if you click again, then you can see these polysaccharides are then coupled to a carrier protein that in this case is CRUM, the diphtheria toxoid protein, and that makes these polysaccharides more immunogenic. Yes, please click on to the next slide. You see the same antigen, but now you can see these, so it's the carrier protein, and there's a linker molecule between the polysaccharides and the carrier protein, and there are several polysaccharides bound to this carrier protein. And so what would be the name of this antigen? It would start off with the parent organism. So the parent organism is Neisseria meningitis, and it's from a certain serogroup, so it's serogroup A, and from that serogroup it's a specific strain, which is strain C1, and from that the oligosaccharide is taken. And then we've got a carrier protein which comes from Corina diphtheriae, and the protein is called CRUM 197. So that's also part of the name, and then it's a conjugated antigen, and that in itself is adsorbed on aluminum. So that's the whole name explained. So you've got a parent organism, you've got a description of the polysaccharide, for which we also have got a separate description, and Edita already showed how we capture polymers. Then we've got a description of the carrier protein, and for that Mirjam has already shown us how we capture proteins in the database. And finally, in a SSG1, so in a specified substance group 1, we capture the absorption on aluminum, in which we also can capture the amount which is considered confidential information. If you go to the next slide, please. So if you go click until it's full, I think, just so it starts off with the organism. Then we come to the serovar, we get the strain, the fraction, and the strain and the conjugated fraction. Then it's adsorbed onto the adjuvant. If you click once more, so we've got the organism, which is the scientific name with the author of first describing it, and it's the serogroup A in this case. It's a whole bacterium. If you click once more, we get the strain, which is C1, and it's the polysaccharide that's derived from that. If you click once more, then this polysaccharide is actually cut into oligosaccharides, and that's conjugated. These oligosaccharides are conjugated on the carrier protein, and that finally is adsorbed onto aluminum. So that's how we build the names, and that gives the full description of the antigens. If you go to the next slide, please. So in the database, it looks like this. So you've got now the hierarchy. So starting off with the scientific name of the organism, then there's different serogroups. Apart from serogroup A, we also got Y, C, and B. And if you click open A, you can see that it's strain C1 from serogroup A. And again, then it's the oligosaccharide from that polysaccharide, and the final record of which you cannot see the full name is actually referring to the adsorbance on aluminum. If you go to the next slide, please. So in the database, it looks like this. So you've got a polysaccharide record. And there, the repeating units of the polysaccharide consist of three different three monomers. And unfortunately, I cannot show you the nice picture. So I've just taken a picture from the internet, because I did not create an example vaccine here. And I've only shown here. So there are three monomers in the repeating units. You only see one here, and it's actually not one in this record, but it's just to show you that we've got all the details in the record. If you click once more, please. So you will also find the structure of the repeat units and the end groups, and Edita has already shown how we deal with that in the polymers. So this is the alternative definition. So we've got a structurally diverse record, and in this record we also create an alternative definition where we can in full detail describe the polymer that is underlying in this this antigen. If you click once more, please. So the other thing is then now we have to also create the linker and create the carrier protein linked to the oligosaccharide, and that's what you see at the bottom left corner. So you can see the carrier protein, you see the spacer or linker, and on the very left side you see the oligosaccharide chain. So again, this is a structurally diverse record, and we've got an alternative definition for the crumb protein, of which you can see the sequence, which has also been published. So if you go to the next slide, please. So this is just an example of one of the more difficult type of antigens that we've been building. And I thought that I will also share where we are in the project at the moment. So we have got agreement on how we name things and how we are building vaccine records. We've been cleansing all the SMS names to get the names with the agreed naming of these records. So these names are available, and SMS will align with EU-SRS later and introduce the cleansed names for the vaccine records. We've got the guidance documents created, as Annet has already told you. At the same time, we are working with industry and FDA on exchanging these records, because it's a lot of time that it takes to build such a record. So we will share our records with the industry, and they will look at the information and share the record with FDA, because we cannot directly exchange these records containing confidential information with FDA. And we hope actually at some stage that the industry can build the records and share both with us and FDA the records, and that we don't have to build them ourselves anymore. But that's looking into the future, also looking at structured data submission. If you go to the next slide, please. So we started off with a list of human vaccine records. We've organized these per microorganism. We've cleansed their names. We are building the records, and the implementation of the correct names in SMAs will take place at a later stage. And maybe you're interested in where we are in the building. If you click once more. So if we look at it from a view of antigens, we've currently built 82%. Well, we're in the process of nearly completing 82% of the antigens. And looking at it from a products point of view, we're at about 67% of the products built. If you go to the next slide. Yep. So what have we built? So if we look at the list on the left-hand side, so starting with Bordetella and Clostridium, coronavirus, Ebola virus, all the way down, these are the more complex antigens, and these are really in good progress. Most of them are near completion. And what you see on the left-hand side looks like a longer list, which it is. The more microorganisms that we have not fully dealt with, but these are simpler, let's say, types of records, and there's also less antigens involved. So you can see that in the left table, we've got 291 antigens, and in the right table, we only got 65 records. We are only building currently records for marketed vaccines. And as I said, we've done the antigens which are most complex, and we've done the microorganisms to which most antigens are attached. So I think we're well on our way. Thank you.
Thank you, Marcel. Thank you to the speaker who can now join us on the screen for the Q&A. And I will discover the questions right now. I saw there are many questions pending. And well,
I think most of the questions were answered. I think
yeah, it looks like, yeah.
SNOMED, we may want to take that offline. At least I do not have exactly the knowledge on SNOMED to properly answer this.
Well, we can just say regarding SNOMED, you know, there is a collaboration agreement between the standard development organizations, and SNOMED is part of this, and ISO is part of this as well. And SNOMED is also part of UNICOM. So I understand the question regarding SNOMED, but you know, it's a little bit like a chicken and egg. I would say the chicken who is originating the egg is IDMP, and the egg can be SNOMED and not the reverse. IDMP is on place since 2012, and it's just because now we are implementing pieces that we discovered that we may do things a little bit differently, but SNOMED was involved in the IDMP development, has been involved in all the steps, and is having other, let's say, business drivers in the clinics than IDMP has in the regulatory space. So that might also explain a bit the difference. I think the other question, which is also interesting because it comes from WHO, I suppose, Antonio, if we cannot compare confidential data, how can we say that it is the same substance in different environments such as FDA, EMA, etc.? Trusting the originator? And I mean,
maybe I'm the one to answer that one. Yes. The thing is, that's also why we are exchanging information or with FDA through the marketing authorization holders. And of course, if the product has the same name and the company really indicates that it's the same product, then we can trust that it's the same. But it would be even better if let's say the company would you know share the record both sides, and that we know that the uni of that record is actually the same as it's in the US, and so I mean, you know, if we use the uni and the EU-TCT, then we would know that it is really the same substance.
I think it's currently legally not allowed, right, to exchange confidential records between Europe and the US. So that's why we have temporarily sort of the model that that industry could share their records then on behalf sort of with all the agencies. That's sort of a workaround, I would say.
That's right. But then if the company says this EU-TCT code is that uni, then it's correct.
Yeah, exactly.
And there's an additional reason, possibly. The company is at the origin of the substance. So they should know. And
Yes.
it's in their advantage to say what is truth and not make mistakes. So, yeah. Who shall I give the floor? I don't know. That was half an hour ago. Christine Assen asked a question about the modification ID. Has this been answered?
Not so, I think. Edita, this is system generated, I guess, right?
Yeah, so something, if you have a code section, every record has its own ID. So it's, also the number. In our case, in EU-SRS, it would be SVG ID. So it's generated by the system. But in another database, it could be another ID. So another code for the same substance.
It is not something that we use towards SMS or anything. It's more system ID.
Yeah. Okay. I think there was a question which has disappeared. It's about the timeline. Has this been answered?
Yeah, I answered it.
Oh, yeah.
I mean,
Okay.
we are running the EU-SRS project with a timeline in Europe, of course, and we align with the US because we work very good together, but not from a global project or anything with a global assignment. There is the GitWig, so and maybe this would be a good platform to discuss this if there could be a global globalization project also from a systems side. But at this moment, honestly, it is our focus is going live within Europe. But I fully appreciate the comment from industry. You need to have one source of the truth somehow. So it's a fair comment.
Yeah, but somehow it is also part of the GDWeek set of pilots, but it's perhaps not major yet. But on the ISO side, we're also working on it in the sense that we are going to adopt a new annex to the ISO specification 19844, which should enable to capture the substance description in a non-IP protected way, and then we can share this information more widely. So it has been written by the same expert as the rest, so I hope it is appropriate. I'm sure it is. Do we have another question?
I thought there was a good question in the chat about the fact that there's the need for substance data in the public domain, right? So maybe that's good to point out. So there is a public, a daily export of the SMS data into the public domain, which is accessible through the SPOR portal. It has a limited set of fields, and we know that there are people who need more fields in the public domain. So we are also, as part of Unicom, investigating what is the need for additional fields, and see if these fields are then available in EU-SRS, and then if we could share them into the public domain. I mean, we have them in the database, so if we get agreement that there is no confidentiality issue, for example, and we can publish that in the public domain to support others who do not have access to EU-SRS, it could certainly be an option. So we are looking into it, but again, first focus is go live with EU-SRS.
Thank you. We have a question. I don't think it has been answered yet. Sent by Marcelo Melgara. In My Health at EU, we have decided to use EU-SMS for substances. I think it was the right decision while pointing to EU-SRS. Now the point is, since we have to provide the reference strength of every substance in multi-active ingredient medicinal product, it is assured the registration process rather than providing strength in bracket, and would it be referred to complex substances? I don't know who can answer that. It has to be read twice, I think.
Yeah, I guess the reference strength is not in SMS.
No.
So that is the area where hopefully we can be of benefit with EU-SRS and maybe add information to SMS or into the public domain. I'm not an expert, so I don't know, Edita or Marcel, do you have any additions?
I think it's more for Edita to answer because it's more on chemicals than for biologicals.
Yeah, and Peter is also on the panel in the meantime, so maybe Peter can also.
But yes, in the chemicals definitely we do have the reference strength in there.
Yeah.
And also the basis of strength.
I'm not sure if strength is not more product specific information.
Yeah, true. Yeah.
This is also what I think.
Yeah, true.
Okay, because the strength inside the substance, I can understand that, but if it is related to the medicinal product,
Yeah, true.
Something related to the volume or strength exactly of a substance, so it's not on the level of SRS or SMS. I suggest we move to the next one. There was a reference to DUI.org in the presentation. Can anybody explain this? Do EU-SRS use DUI to generate unique global ID? I don't know what DUI is, I must say.
I don't think so. Do you know, Edita? I don't know.
No. Okay.
So we didn't have any reference to dollar. Oh.
I don't think so.
No.
Not as far as I know.
No.
Maybe temporarily loaded through the US data, but we will not have it in the EU. I'm pretty sure of that.
Am I wrong that UMC was considering something like a global ID?
Yeah, so I'm not sure if anybody from UMC is here, but yes, UMC is working on UMC-SRS, and this may be used to establish a global substance ID later on. And they're also, as far as I know, the lead in the global substance, the GITWIC, the Global Identification Working Group.
Mm-hmm.
And also there, the discussion on global substance ID is pretty crucial, and PHP ID. So yes, I think they have made the choice to go for the same software as US, Europe, and others in order to smoothen later on globalization.
Indeed. Indeed. And I don't think we have somebody from UMC here.
I think Sweden has a day off today.
They are lucky. Okay, so we cannot answer this more than it is not known in our space here on the stage. So another question or comments question for electronic information or e-labeling. There are discussions using FDA GSRS to name substances. When would it be possible to use EU-SRS to do that?
Yeah, so we are expecting to go live with EU-SRS pretty soon, next month, next month. And we have all chemicals then available, but not yet every, and most of the other substances that are used in products. So I guess our focus is good to prioritize on those. So maybe it would be good to have a follow-up discussion on this and to see if we can work it out, because if it's about EPI and e-labeling in Europe, that would be good to use EU-SRS data instead of US data, I would think. So not that the US database is not useful, of course, but since we have EU-SRS. So maybe we can discuss this further, Catherine.
Thank you, Annette. Well, it is exactly an implementation question where we have the widest base of information available, and probably the Americans are ahead of us.
Yeah.
So it is.
I mean, when we load the data, we have a data load prepared, and there we make use of the public information, public data from the US colleagues. So we're very grateful both with the software and the data. So we use it as a basis.
Good. Who do we have for another question? Okay. Will end user be able to view and search substance data in EU-SRS, at least the public data?
Yeah, so that's what I mentioned before. So EU-SRS in itself is behind EMA firewall. So only NCA users can access the system in itself and search. We will look into, and then on the other hand, some of the SMS data is published into the public domain. So we are actually starting to look into, okay, what are the fields at least that are needed into the public domain, and can we be of help there, feeding that from EU-SRS? And there is on the wish list, of course, also a public version in Europe for EU-SRS, but not in the next year or so. So I think we need to look for a sort of an interim solution there and see what we can make available.
I would be much in favor of having a public version.
Yeah, of course. Yeah.
I think we have Pedro Batista also with us, but I didn't pass him the floor because I don't see him on the screen. But do you want to add something to this question, Pedro?
Pedro, you're muted.
Yes, you are muted.
Unfortunately, he is unable to speak.
Okay.
He has no microphone.
Okay.
Okay, then Pedro, if you can answer something in written, that would be great. Thank you. Okay, I'll see if we have further questions because that one is now behind us. Well, the question Marcello was asking is a bit still, it remains open and is rather complex, was about the strength. He completes the question by saying, I was referring to the effort of including in SMS complex substances that may induce difficulties while defining the reference strength for a pharmaceutical product. But I don't think, I mean, I would like one of you on the panel to answer this, but I don't think it changes from what we said before. It is linked to the product rather than to the substance, even if the substance is complex. But perhaps, Marcel, would you say something about this?
Well, I'm a bit out of my league here because I'm not a pharmacist nor really into the chemicals, but as I've always understood this whole system was that the basis for strength would also be a part of the substance definition part. And in that sense, I always understood that this would also help in really defining, let's say, the reference strength and getting it better into the product. But maybe Edita can help you, and definitely Herman would be able to say something about this.
Because Herman is a pharmacist as well.
Yes. But that's always what I've been informed about. If it doesn't depend on the salt form, because it really is the reference strength, and that's also indicated in the substance.
Yeah. Well, Herman is actually in the attendance. So if Herman moves his hand, I can give him the microphone. But he doesn't seem to move. Oh, yes. Where is he? Oh my God, he's gone. Here we are. Voilà, Herman.
Herman is already enabled to talk. So
yes.
Herman, please
Okay.
go ahead if you unmute yourself. You are unmuted.
Yeah. Herman? Well, we don't hear you, Herman. That's suboptimal.
Yeah. We do have an answer from Pedro regarding confidentiality. The public substance data is already available in several systems: SMS export, XIVMBD, EUTC, and IRIS. While restricted substance data is available only for EMA and NCAs via the SMS API. That's the answer from regarding confidentiality.
Excellent.
But we also heard, for example, that things like CAS numbers and other codes that we capture are of interest to the outside world, and these are also not yet in SMS. So these are specifically fields that may be of interest in sharing into the public domain. The mapping of SMS ID, UNI, CAS numbers, etc. So we need to look further into what we can do and then see if that would help the people using the data in the public domain.
Exactly, and that answers actually the question and comment from Aziz. As Annet mentioned, it will be interesting to have more fields in the published public data, for instance, molecular formula, molecular weight, etc., but also CAS, INN. Okay.
Thanks, Aziz.
Yeah, good. We have a question here. Should we expect to see unique records in EU-SRS for adjuvanted vaccine as described in specified substance group 1 and in EU-SRS at present? Sometimes we only see the protein or reference substance in SMS. That's for Marcel, I suppose.
I think we already got some of the adjuvanted vaccines in SMS, but SSG1 can be captured in SMS. So yes, there will be there as well, if I'm not mistaken. And otherwise, Pedro has to type that he disagrees, but I think this is correct.
I think the focus of SMS is the level of a substance that is selected in a product. So parts of a substance that define the substance may not be captured in SMS, just the level at which the user selected, for example, in PMS or UPD. And other elements that we are building in EU-SRS will not have an SMS ID, maybe later, but for the time being not.
Thank you. Well, we have the last comment, so an additional comment from Antonio Romeo. I would say perhaps he should express himself because that's
well,
I don't understand exactly what that means. Annet, you know?
Well, that is also something that we have been discussing, that, for example, was it last year where ATC codes are changed, right? So if you build a record and you have a certain code, if the code changes, that is something that we need to take care of in the process, is how we monitor the changes. Mm-hmm. So if the comment regarding CAS is referring to that, that is something that we are in the project team looking into, how to make sure we keep it up to date, not only at the start when we build a record, but also maintaining. So master data management is not easy, I would say.
Yeah. Then we have answered that. Thank you.
Pedro has also a comment in the about the vaccines.
Yeah, can somebody read that comment?
Yes, I can. So Pedro says, although they have not yet been cleansed in SMS, there are indeed adjuvanted vaccines already available in SMS, which are the ones that have been requested by applicants or reported in ICSRs.
Thank you. Thank you, Pedro. Okay, so that is also answered. Well, I don't think we have further pending questions yet. Do we?
Don't think so.
I don't think so. Okay. But it was a living Q&A, a very good one. So maybe I see something has come up now. Maybe then we are a bit early, 10 minutes early, but if we have exhausted the questions, we can come to the conclusion. I want to thank our speaker, and especially Annet Rozema, the lead of this work package 2 of UNICOM. Annet and the colleagues, they have spoken repeatedly about the deliverable of UNICOM, which is coming out rather soon, I think in a few days, next week or so. I invite everybody to have a look to this deliverable. It will be extremely important, and extremely important also in light of the discussions we have had today. If I understand well as well, for UNICOM, we're also interested in comments and feedback for this publication, although the delay may be a bit short to answer or to evaluate all that. So, beside Annet, who I mentioned perhaps a bit too much compared to the other, which is not very polite, every expert has brought its piece of expertise in this conversation. I think it is the first time in the Committee of Expertise that we have so much detailed experts and effective deep dive in the domains. And for that, Mirjam, Edita, and Marcel have been a great help to help us to navigate. For those who may later look at the slide deck, which will be published, you will see in static form what we have seen live in the demo, so it's not lost for you. If people from you or others want to listen back to the recording of this on YouTube, that will be published, I suppose, by Monday or so. And we invite you, of course, to visit that, especially if you have a Swedish colleague, inform them that while they were enjoying their holiday, we were working for them and they can listen to us. So this said, thank you to all, and Pedro also, even if we didn't hear his voice, he's certainly a good singer, but we were bound to the written way. But thank you for having joined us and supported us here. It's very much appreciated. And with that, we give you a rendezvous for early February next year for the next Committee of Expertise. Thank you again.
Thank you.
And keep safe and have a nice holiday period. Well, it's a bit early to say that, but nice end of the year. Goodbye.
Thank you.